Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain Free with Dr. Marc Darrow, and we are right here, right now, live in the studio taking your calls, 866-870-5752, and we are speaking with Nicole, and Sherry and Richard will be next.
Thank you guys for hanging in there. Nicole, the Dr. Marc Darrow, we were talking about your friend with sciatica, and for about 3 months, and I was telling you that from what I've read, the studies show that about 94% of sciaticas go away by themselves without doctors. So that's good news. I'd only be concerned really if there was a lot of weakness. You know, a person can't stand on their toes or their heels. That could mean a nerve is really crunched and may need some quick treatment. Oftentimes what people think is sciatica really is not sciatica, which is an impingement of nerves that go down from the back down to the bottom of the foot. And in some cases, it's like that. So there can be trigger points from the lower back that refer down the leg. And I might call that a pseudo-sciatica. It's not a real sciatica, and it's not nerve involved at all. And again, like I tell every single person who calls in and every one of my patients, I need to examine you first with my hands and move your body around to see what the real problem is. The images don't tell me. They give me wrong information every day. And I find that the images often throw off doctors because most doctors, believe it or not, do not examine the body. They get an image to decide what they're going to do, if they're going to do surgery. I've had endless patients over the last 25 years who have been operated on because of an MRI, and then the surgery came out bad, and then I find that it wasn't the problem you see in the MRI that's causing the pain, and then we can help them. So I get a lot of post-surgical patients that we can heal also. So at any rate, I need to examine your friend, find out what's going on, touch the body, move them around. There's different tests I can do, and see what is really going on and see if I can help. Do you have other questions about that, Nicole?
No, I'm going to have her call your office, but I do have a question about platelets.
Okay.
I'm a blood donator and platelet donor.
Good.
And one time when they were taking the platelets, they said that they were getting a triple count. What does that mean?
I don't know what that means.
Okay. It had me a little worried. I didn't know if I had too many platelets, and I didn't know if it was good or bad.
No, you know, one thing about medicine is that there's terminology that everybody knows, and then there's terminology that some people make up at the time to describe something. So I'm looking it up right now. Triple count platelets. And I'm going to see if there's something that refers to. Okay. Here's what it says on Google, my favorite place. Depending on your individual eligibility, you may be able to donate 1, 2, or 3 units of platelets during one appointment. So what I'm going to guess that means for you is that you have enough platelets that you could actually donate 3 units of platelets during one appointment. Okay?
Oh, okay. Okay. So it doesn't sound like bad news.
No, it sounds like great news.
Okay.
I mean, it could be. They would have told you if it was bad news.
Yeah. Well, they were tapping on the machine, and I thought, what happened?
I mean, I would ask your doctor. You should get a blood count and see what your platelet count is, because you could have too many, which is, where the thrombocytes are in excess. And I doubt they probably would have told you that. You're probably in the normal range.
Okay. Well, they sounded like they were excited about it, so I was a little worried.
Yeah, I would.
But,
I would
uh-huh.
get a blood draw sometime, or you probably have had one with your doctor, and say, hey, I heard this term, and I looked it up on Google, and I found out that it means I've got enough platelets to donate 3 units. Is it too much? Do I have too much?
Oh, okay. That's a good question.
And I doubt you do, because I'm sure you've had your blood drawn by doctors before, and no one's ever mentioned it to you before.
No, that's why I was a little, curious, because I thought, well, how come nobody's ever told me this before?
You know what? I love when people go to Google. It took me 1 second to find that, right?
Well, I'm going to start doing it a little more often.
And also another thing that people can do who are not medically educated is if they're looking at anatomy, for example, let's say you can put in the term meniscus tear. It'll come up on Google, and then in the upper left-hand corner, there's a spot that you can click on that says images, and you can get the actual anatomy in different photographs or drawings so you can understand what your doctors are telling you or what your images are showing. We can be smart today. And I'm challenged by patients every day, which I love. The one reason I love medicine, not the one reason, but one of the top reasons, is because it's endless. I love learning. I did 22 years in college. I've got, I studied law, I studied medicine, I did a master's of tax at night for 3 years. I did a master's in natural medicine. I keep learning. I learn every day, and I love it. I love being stumped. That's why I love the show, because people call in like you just did. I learned something from you. I never heard of that before. Because medicine is...
I've been listening to you for a long time.
Well,
and
thank
I'm learning
you.
every day, like you said. And I already know if I have an issue, I'm coming to you. I already know that because I've been listening to you long enough that I know what you do, your research, you test yourself, and that's what I want, is someone who really, really knows what they're doing.
Well, in musculoskeletal medicine and natural medicine, hormones, I'm the guinea pig. Everything that I've ever done with a patient, I've tried on myself first.
Yeah.
And I can tell you this, there could be, I'll make up a stupid number because I don't remember, hundreds of things that I have tried on my body that did not work for me, and I don't have patients do them. And then I've had a myriad of things that have worked for me, like regenerative medicine, stem cells, platelets, hormones, different supplements that have worked on me. And then once they work on me, I tell patients about them and ask them if they want to try it. When I first healed my own body doing regenerative medicine back 25 years ago, I asked patients if I could try it on them. And I said, this is experimental for me back then. It worked on me. I don't know if it'll work for you. And almost everybody said, please try it on me. I don't want to have surgery. And then before I knew it, my practice was not doing steroids and medicines anymore. It was doing regenerative medicine of injections that actually healed the body. So I've been very lucky. I've had a great life, musculoskeletal-wise. I've been injured all over the place, and everything I've injected is healed. I mentioned in the first half hour of the show, I was hiking on the beach at 6:30 last night, and the tide was high, and a wave came out of nowhere and knocked me over, and I fell on the rocks, and I'm scraped up all over. My shoulder hurts, my back hurts a little bit, and I'm hoping this stuff goes away. But if it doesn't, guess what I'm going to do?
You're going to treat yourself.
I'm going to treat myself. Yeah. People go, how can you inject yourself?
I'm going to keep listening because I'm anxious to see how that turns out.
Yeah. Well, I'll let you know next week how my shoulder's doing. That's the part that hurts the worst. I've got a big raspberry on it. I've scraped it down. And
ouch.
My forearm is all scraped up. My hand is gouged with laceration. And I am going to get a tetanus shot. I'm going to CVS after the show and get a tetanus shot. And I hassle them at CVS whenever I get a vaccination. I go, I'm going to do the shot myself. And they go, you can't do that. And I go, I'm a doctor. I do it all day to myself when I need to. And I've been doing it for 25 years. And honestly, as much as I love you and I think you're great, I think I trust myself more than I trust anybody else.
I like that, yeah.
All right, Nicole.
Dr. Darrow,
God
I
bless.
Sure do appreciate
Thanks
you,
for your
and
call,
I'm gonna
Nicole.
continue
Yeah,
to
this is a great
listen
call.
every
It gave a
week.
lot of information, and I'm not a big fan of doing steroid shots for sciatica, and it may not be sciatica, and we may be able to heal it up just using stem cells or platelets. All right, I'm going to give out the phone number once more, then I'm going to get to Cherie and then Richard. The phone number to talk to us live right now is 866-870-5752. And to call the office to get other information or make an appointment, the phone number to the office is 800-300-9300. And you go to the website if you want to see these videos of procedures that I do. And if you call in, I'm going to give you a free copy of my book, Stem Cell and Platelet Therapy. Regenerate, don't operate. So we're going to Cherie. You have a compression fracture in your T12 vertebrae. Is that correct?
Yes, doctor, it is.
And how long ago did that happen?
5 months ago,
Okay.
in February of 2023.
Okay. And what did your doctor tell you to do about it?
They want me to follow up with an MRI. So far, I've had 2 X-rays and I've had a CT scan.
Okay.
And to read the results to you, the findings were T12 superior end plate compression deformity with a 25% loss of height.
Okay.
And when it initially occurred, it was extremely painful. And since then, from a pain level, let's say around 7 or 8, it's down to a 2.
Okay.
And if I overdo it, if I do too much yard work or house cleaning, the pain will shoot up to a 5.
Okay.
But then after a few days, it will go back down to a 2. So before recommending surgery, they want me to get an MRI, which I have not done yet.
Okay.
But
So let me ask you a question. Can I ask you a question first, and then I'll let
Sure.
you do yours? What kind of doctor did you see for this?
Up till now, just the general practice.
Okay, here's what you got to do. Get a pencil and paper and write this down, okay?
Oh, okay, I'm ready.
Okay. So there are sometimes procedures that can be done where the vertebrae can be expanded back to its normal height. All right? And it's done very easily by just an injection. I don't do that, but I'm going to give you the name of someone who's an expert in it, a doctor who does that.
Oh, okay.
You ready?
Yes.
His name is Win Bai, Hyunbae.
And spell that again.
Yes, first name Hyun, last name Bae.
Okay.
He's a big, handsome orthopedic surgeon, and he's wonderful. He's very sweet disposition. He's conservative, and he'll tell you the real scoop on what you should do. The reason I want you to get in there right away is because there may be a window of opportunity for that fracture being reduced and put back into its normal shape. Okay? I'm actually looking on the internet at his information right here. I'll give you his phone number.
Oh, okay.
It's 310-828-7757.
Was that 828?
310-828-7757. That's an orthopedic surgeon named Win Bai, the best in the business that I know of for compression fractures, spine surgeon.
And so it doesn't sound like stem cells or platelet.
I don't know yet, because what I want you to do first is make sure that you can have it reduced or not reduced. If it can be reduced, that may get rid of 100% of the pain immediately. Then you won't need me. If it can't be reduced and there's nothing to do, then I'm the guy to use stem cells or platelets to stabilize it.
Okay, so stabilization is possible with what you do.
It is, but I don't want to do that. I don't want to put the cart before the horse. I want to make sure that something else cannot be done first that would heal the whole thing.
Excellent. Oh, this is
this guy's a prince, believe me.
Wonderful information.
I don't give out
will call him.
referrals very often like that, but this guy I really trust a lot, and I don't know him very personally. I met him years ago when he first started doing this work, and I was very, very impressed. And then several of my patients have gone to him with great success.
And have I done extra harm by waiting 5 months?
That's what you have to ask.
That's what you have to. You
have to ask him about that. I wouldn't wait another minute. I'd call right now.
Okay.
Yeah, you can always
all right.
call.
Well, I needed to hear that because I was just going to wait for the body to heal itself.
Well, the body can't heal that. You might end up with no pain, but it's a deformity, and that's a case when a procedure may be necessary, may not be. I don't know the answer. I don't do that work.
Okay.
All right, Cherie, God bless you. Thank you so much for calling in.
Thank you for your call, Cherie.
It's amazing because your call, I'm sure, has helped so many people.
Absolutely.
So I'm going to give out the phone number to the studio, then we're going to get Richard on the line. The phone number to talk to me live right now is 866-870-5752. And if you want to call the office to get more information, the number there is 800-300-9300. Richard, your big toe hurts. What happened?
Hi, Richard. Are you there?
I'm here.
All right. We understand this is Dr. Marc Darrow on 870
Loving your
AM.
show.
Oh, thank you so much. I love it too. I like to torture Nita. So what happened to your big toe, Richard?
Oh, about 15 years ago, I was kneeling down. I teach and practice martial arts for 45 years. My body's pretty banged up. And I've had 5 spine surgeries, knees, everything. But this injury on my big toe is probably the one that is affecting my life the most.
Okay.
I was kneeling down helping a student with my toes pointed towards the ground and my knee on the ground.
Yeah.
And an adult fell on the back of my leg, and it hurt my big toe joint.
Yeah.
I waited a year before I went to see a doctor because my toes are always banged up from kicking people, and I thought it was just going to heal like it always does.
Sure.
And the doctor at the time, at Curl and Job, told me that I tore the ligament off the bottom of the joint on the big toe.
Okay.
And that the bone was not in the proper position for that joint, and that I had waited too long, and that ligament can't be pulled back and put in place.
Okay.
So I'm wondering, it's a structural issue, I realize. I know that ligament, I understand the role that ligament plays in keeping things lined up there in that joint.
Yeah.
But I love your outside of the box kind of thinking, and I'm wondering if you have any input.
Yeah, I'd have to examine it. I think I could probably help you.
Okay. Okay.
I deal with stuff like that all the time. I can't promise you anything. There may be more than just a ligament tear. There's probably some arthritis by now after all those years. It sounds like you hyperextended that toe and tore that or stretched it out. But a lot of times those things, the actual ligament can heal up by adhesion, scar tissue. But it may be the actual joint or something else I'd have to see, or it may be the plantar surface of the toe, where the toe attaches to the foot.
Okay, I will give your office.
There's just a lot of different possibilities, yeah. It could be a plantar plate tear. I don't know. I'd have to touch it and see.
Okay.
Well, God bless you, man.
So much.
We appreciate your call.
Thank you, Richard.
So Dr. Marc Darrow here again. We're going to get to Dave in just a second and give out the phone number again, get a few more callers. We got a couple minutes left. Phone number to the studio, 866-870-5752. We love your calls. And if you want to get a hold of the office, the number there is 800-300-9300. If you want to email me live, go to www.jointrehab.com. That's my website. Every page has a spot to email me. So Dave has a question about his hands. Dave, what happened to your hands? How long ago?
Okay. Can you hear me?
Oh, yeah. Perfect.
Okay. My question is this. My hands, I worked in an industry for over 40 years, using my hands. And this is the way I describe it. It's a numbness where my fingers connect to my hands. And every time I go to these doctors, they sent me to these doctors. They look at me like they don't know what to tell me.
Okay.
And that's the best way to describe it. And I was wondering what you do can help me out. It's a numbness where my fingers attached to my hands. What do you?
How many fingers does that occur at?
It's all 4 on each hand.
Not your thumb, just your digits.
Not my thumbs, just my fingers where my fingers attached to my hands.
Okay.
And
is it on the back of your hand or on the palm of your hand?
On my palms, where the fingers attach at the palms.
Okay. What's the industry that you've worked in for 40 years with your hands?
I did in printing and design, and I used a lot of computers.
Yep.
And I handled a lot of paper.
Okay. So I'd have to touch the area to see what's going on. There are things in that area. There's anatomical things that you could have hypertrophied, which could be cutting off the nerves. That's something called the A1 pulley. You can look that up on Google. Oftentimes, when that's the problem, you'll end up with trigger fingers. You can look that up too, and then Google that and put images so you can actually see what I'm talking about. So I don't have any answers for you right at this minute, and I would have to touch the area, move you around, and see what's going on.
Okay.
If you want to get to the office, the number there is 800-300-9300.
Okay. All right, that sounds good. They're trying to put an end to, since it went through workers' comp, they're trying to put an end to it. And they said that they'll give me medical money. But to them, it's all a mystery, it seems like.
Well, there are a lot of things that remain mysteries because doctors don't know everything.
Yeah.
We'd like to think we do, and laymen certainly want us to know everything. But let's face it, doctors are just human beings who learn certain things, but we don't know everything. I'm not going to make us out to be some kind of special people. We're not.
Yeah.
And I'll be honest with you. In my line of work, Dave, almost all the patients who come in have the wrong diagnosis. And I'm not saying that from an elevated, intelligent point of view. I'm saying that because I don't rely on the images. I touch the body to find out what's going on, and the images don't give me the information that I need most of the time.
Yeah. Yeah. Okay.
I mean, I can give you an example. I'll give you an example right now. A woman came in last week, and she said that her doctor told her she had a meniscal tear in the right knee. All right? He didn't look with an ultrasound. He just examined her. I looked with an ultrasound. There was no meniscus tear there. I get other information sometimes. We'll get someone that gets an MRI where the doctor thinks it's going to be a meniscal tear. I'm just using that as an example. It could be anything. And then it comes back, and there is a meniscus tear, but there's no pain in that area. We just find all kinds of things that we think shouldn't be that way. Sometimes I'll find someone that has, because I look with an ultrasound as soon as they walk in, a meniscal tear in their left knee and not on their right knee, but it's the right knee that hurts.
Okay.
So we can't just count on what we see. We've got to touch the area, move the patient around, do a good history. God bless you, man. We appreciate you calling in. It's the end of the show. If anybody wants to call the office to get more information, the number is 800-300-9300 to the office. That's 800-300-9300. You can watch me do videos on the website, www.jointrehab.com. God bless you all. Thank you, Nita. Thank you, Kevin. And thank you, everybody. And Suzette.
And I'm Nita Valens. We'll see you next time.